Hello folks, this is Dr. Abbas, and again with Bariatric Bits. So, weight loss plateaus, very common in the vast majority of patients. When do they happen? Well, it's variable. They can happen from 3 months to 6 months. There are a few things that you have to consider when we look at weight loss plateaus. There are really three main reasons that you can have weight loss plateaus. Number one is everyone's weight is really dictated by their genetics. So what does that mean? So that means I can have 10 people having the exact same operation, but they will lose different amount of weight. And again, that is because of their genetics. The second part of that is some things that we can control. It is your diet. So as time from surgery goes further, you are going to be able to tolerate more food. But generally, you're not going to be able to tolerate a lot of solids. So what will happen though is people will have what I call a high dense meals. Sugars. So chocolates, even protein bars. I personally am not a big fan of protein bars because they pack a lot of calories in a very small amount. I would rather have you eat your calories. Your salads, you're focusing on proteins. That kind of food keeps you more satiated. And remember, if you have 50 grams of protein and 50 grams of carbs, while they have the same number of or amount of energy in them, the protein uses more calories just to burn and get digested. And it also keeps you more satiated. Hence, why the keto diet works. We will talk about keto diet in another clip. One more thing that will determine that is your activity level. So, 3 to 6 months out from surgery, I will ask my patients, don't just look at the scale, wear tight pants. Wear tight pants and tell me if those pants are getting looser on you. If your pants are not getting looser and your scale says you've plateaued, then we need to do something about that. And we have a few options. We can put you on adjuvant, medication to try and kick speed things. One thing that you can do is the quote-unquote resetting your sleep. So you go back to the postoperative diet immediately. What that means, you do 1 week of liquid diet, you do 1 week of phase 2 diet, and 1 week of soft diet, and then you go back on regular meals again. And you can do that multiple times. But focus on proteins. That's a predominant method of trying to help you to lose weight. Fish, chicken, but also watch what you put in there. So a lot of people like tuna, for example, but they will put a lot of mayonnaise in there. We kind of defeat the purpose if we overdo it that way. You got to pay attention to these little tips. One absolutely great resource for you is going to be my bariatrician, okay? Both Ms. Janie and Cynthia in our bariatric center. Please give them a call. Write down, and before you call them, write down a whole week's of diet. So when you go and see them, they can briefly look at what you have been eating, but be very precise. Because remember, even if you took a piece of chocolate and had it, write it down, because that will make a difference. What I notice with patients gaining weight is they actually drink their calories. So, or they'll have chocolates and other foods that essentially melt in your mouth. Because they melt in the mouth, you never feel satiated. So very soon after you consume a whole bar of protein protein bar, you're going to feel actually probably hungry again. So that's why I would rather at 3 to 6 months from the surgery, you eat your calories. Remember folks, we have one life, one body. Again, we can control our body and get in a better health, better place that we can control our surroundings. And we've got one chance at this. So why don't we make the most of it together?